Okay, so say somebody has one of these meters, they have a Keto Mojo, they have the strips, they want to test to see if they're insulin resistant. Let's take it right from the beginning. They've never used their tester yet. When do they test? What are they looking for?
The devices that they test with today are 21st century technology. They are simple enough that we have young children test their blood sugar knowing how much insulin to give if they are on the other end of the spectrum. Meaning they need insulin. You have too much insulin. So pricking your finger, I first warn people, do not prick on the tip of your finger. Go to the side of the finger. That's where the least amount of nerve endings are. And when the spring-loaded prick, the visualization is really helpful for most patients. It is not an open bore needle. It's like a pin stabs you, and it's not that bad. It is really not that bad. What will happen is a little dollop of blood will pool on your finger, and the strip inside the device has a channel that will pipette that blood into the channel. It's really awesome technology. I know I'm being a little detailed into explaining that, but the engineering of how reliable these point of care strips have become. In my career, they were trash at the beginning, and really we needed a few blood tests to make sure that we were on track with diabetics. Now I can rely on their meter more than I can rely on our lab test almost. It's really that reliable. So the technology is great. You prick your finger. I tell folks to first test the ketone before doing the blood sugar. The ketone takes a little bit more blood. So you put the ketone strip in, you prick your finger, and you put that strip right to the tip of that pooled blood. It will siphon it up into there. 9 seconds later, you're going to know your blood ketones. You pull that strip out, put it down, put a blood glucose strip in there. And many times I have to have patients milk a little bit more blood out if they didn't have enough. And then their blood glucose will be there in 5 seconds. So in a matter of 30 seconds, we have both blood glucose and ketones. I start by telling patients to test when they're brave, because the first one is usually do it with a friend, and then the immersion therapy that this is not that bad has happened, and now you can hopefully be brave and do it on your own. But when I get the most data that's valuable, at the first week, I let them test whenever they want. Just test when you're curious. And when they sync with their app, I'll know what time they tested. That is really helpful. And as they mature into that second or third week of being on a ketogenic diet, I said, don't waste the strips. The only thing that matters is what is your metabolism doing first thing in the morning. So we call it TOT. Test on the toilet when you get up in the morning to empty your bladder. Before you walk the dog or make the coffee, no, right first thing in the morning, we want you testing your numbers, because the noise that is your metabolism. Thinking changes your blood sugar. A big bowel movement changes your blood pressure. Walking the dog clearly changes your blood sugar. Do not do those things before you measure if you want to analyze yourself correctly. So the most valuable check is when the noise is the lowest, which is first thing in the morning. There should be a purr of ketones circulating in your body, meaning you haven't had any sugar for over, hopefully 8 hours, but most people, it should be 12 hours, should be how long it's been since you've had your last meal. So 6 o'clock at night was supper, or maybe 7 o'clock was supper. Now you're checking it at 7 o'clock in the morning, and your blood sugar should have been emptied. It only stores a heaping teaspoon of glucose at one time. Your liver constantly replaces it, but in people that aren't healthy, it is used to sweeping way more sugar into the circulation than it should. So first thing in the morning, when their blood sugar is greater than 100, we know there are problems brewing. And the chances that a blood sugar greater than 100 has a good ketone is unlikely. But check it to measure, and if the blood ketones are what we call non-existent, is less than 0.5. So that number is like, it's not zero, but it's zero effectively. And as people grow healthy, they don't let that ketone number sink below 0.5. It stays in a nutritional ketosis zone, which is 0.678. Mine this morning, I think, was 0.91. And I just checked right before the show, and it was in the 1.5 range, meaning tapping into my stored fat is what my body is in shape for. And that mechanism is what is needed to take out the trash in your cells. So when we are looking at these aging syndromes and people don't look at this metric, their insulin still wins. They make adjustments, but their body then adjusted too. So checking urine ketones has always been something I get lots of questions for, and I 100% use urine ketone strips. We call them ketone strips for the first couple of weeks. And it's mainly because you got a lot of changes going on, and really what we want to know is, are you peeing ketones? Is there enough ketones that they're spilling over into your urine? That's a really good sign for the first 2 weeks for newbies. But eventually, your body is not that wasteful with fuel, specifically your fat's fuel. It's very conservative. And as soon as you don't need excess, your body will learn how to produce what is right in the sweet zone for your needs. Those needs are very easy to measure first thing in the morning. So that's where we look at this.
For somebody who hasn't made a dietary shift yet, and they're having a very conventional type diet with moderate to high carbs, even if they stop eating after dinner, say 5, 6 p.m., and then they fast overnight, do a reading like you talked about there, get the blood glucose and the ketones, will the average person produce any ketones? You mentioned that number of 0.5 that we need to get to actually be in ketosis, but your average person, will they even show like a 0.1, 0.2?
You know, and even the 0.1, 0.2, I would say is a statistical error the meters are great, but they do have a plus or minus 0.4 for their accuracy zone. So here's the best part is, when people are trying to get healthy and they make a change in their life and you're like cheerleading them on, galvanize the heart, just get them to keep going. And then they have rewards, they feel better, their body's doing a little improvement, and then they stall. And this hidden monster of excessive insulin, of metabolic disease, it's tricking them. They're following all the rules that the neighbor was able to follow and lose all that weight, but they're not losing. And to me, what is the key so I'm dodging the answer because you presented something that I don't know the definition of, which is, does the healthy person, does the average person? And I'm like, it is what has been the most humbling thing for me was to try and predict what's the metabolism of the patient in front of me. Can I look at, there's some, striking labs that I could make good guesses for, but for the most part, people coming in trying to live a healthy life, are they making ketones in the morning? Do they ever make ketones in the morning? And I just to learn, stop guessing and look, because it will sabotage any solid reversal of a weight problem. And whether they're using paleo or carnivore or they just take out fast food, each one of those improvements in their food choices shifts their metabolism. And initially, their body has to respond. It kind of overreacts at the beginning for the safety of survival. And so you'll make ketones in that first 2 weeks of a shift of especially dropping calories or particularly dropping carbohydrate intake. The next step, though, is your body says, oh, these are the new rules. And then the body adjusts. And because of that history of 25 or 30 years of living off of only glucose, the ketones will become 0.2 or 0.3. So your answer is most people make no ketones unless they're trying to. They really work at it. Now, I'll make some exceptions. Like when I see people who are, they're really lean and they work out. They are not the people who come see me at an internal medicine clinic because they're healthy. They have a rarity for making they're not all making ketones either. You can usually get it from their history. So I have a couple of friends who love to run. It's like the way they lower stress in their brain is to put on 30 to 40 to 50 miles in a week. And that's just their coping skill for life. But when they're not running, they're on a 2-hour eating cycle because carbs are what fuel them. Now, I'm pretty certain at the end of their run, their body has to be making some ketones. But the markers of inflammation and chronic disease and autoimmune disorders and hair loss and brain fog that happen in all of them eventually give testimony that there's more to this than just making ketones once in a while. Like, they make ketones when they run, but their body doesn't have that flexibility of turning on and off a metabolism. And really, that's what we teach at the Dr. Boz team. That's where I think there is just there's a vacuum of hunger, excuse the pun, of people that want to understand why their bodies are stuck. And one trip through some of these lessons, and that most of them you can find on YouTube, and they are able to say, oh, I wonder where I am. And that's where I find success. They're curious enough to say, yes, this is what normal looks like, and I wonder where I am.
So coming back to our patient who wants objective data to determine whether or not they're insulin resistant, before they make the dietary shift, before they make any of the changes we're going to talk about today, but they have a keto mojo, they are testing on the toilet in the morning. You gave some different numbers there, but what are they looking for to know they're not insulin resistant, or to know that they are? And is there a certain number of days data they would want to be able to, take that data and put it together and really determine something?
Sure. Okay. Let's cut to what would I look at for a glucose ketone number that would tell me they're not insulin resistant? It would be a glucose that is at least 2 digits in the morning, meaning I'd love it out of the 90s. I'd love the glucose in the 80s, 70s, or 60s. And I'd want the ketone to be at least 0.5 or greater. That is a really good safety flag that says their metabolism is pretty strong. I mean, they're not trying to do this. Is before they change any of the things they're doing on a normal daily time. I mean, my friend Sean Baker, you know who he is?
Yeah, I've interviewed him.
Oh, have you? Okay, he's a great guy. But he's got, my thighs are the size of his biceps. So he's got muscle mass that is a really great experiment to run. He was on the phone the other day and said, yeah, we should get back on. I'm like, oh, Sean, if you come back on my channel, we got to do your labs again, because it's always fun for me to see what is it that really healthy metabolisms do. But it's a great testimony for him that he eats only meat. And his glucose has had struggles. He's a man who's had times of life where inflammation got the better part of him, or an injury got the better part of him. But he always makes ketones. His ketones are 0.678. His body is always burning at a rate where he has to burn fat to support that level of muscle mass. And it's just another good testimony to say, yeah, he eats no carbs, or very few. And that metric plays truth in him. When I get a little old lady that's 90 years old and she has no body fat, but she eats toast and tea, her blood sugar in the morning is frequently above 100. They're lean. She hardly eats a thing, and her ketones are less than 5. The metabolism inside that little old lady is broken. And to resurrect it, we have to figure out how that she burns glucose less and teach her mitochondria how to burn fat or ketones a little more. And in that journey is the messy part.
If you enjoyed that clip, you're going to want to head over here and catch the full episode. I'll see you over there.
If I had to put one demon out there for the chronic diseases that have filled my internal medicine clinic for 20 years, insulin wins. You can say, Doc, I want to check a fasting insulin. And we have lots of people do that. But the fasting insulin